Hey everybody, welcome. Today we're talking about, are fibroids painful during pregnancy? I'm Dr. Perkins, a board certified OBGYN, and so it's exciting for me to talk about fibroids with you. And so we'll start the conversation by talking about what exactly are fibroids and how prevalent are they? We'll discuss the symptoms of fibroids. We'll dive into the pains that may come along with fibroids in pregnancy, and we'll talk about safe pain relief options. And while we're at it, if you hang until the end of this video, I have a free gift to give to you, all right? But until then, let's talk about what exactly are fibroids. Fibroids are a social term that we use to talk about these masses or these tumors that grow in our pelvis as a female. Fibroids don't grow in males as well. It's a female thing, right? And so inside of our uterus, we have a muscle, a massive muscle that is usually the size of your fist. And during pregnancy, it grows and grows and grows to fit an entire baby, a lot of amniotic fluid, a placenta, which is huge as well. And it does all of this in this one muscle that is usually the size of your fist. Pretty remarkable. Now in those muscles, we have muscle fibers, and those muscle fibers can kind of go astray and create a mass that grows like a ball inside of your uterus, in the center of it, in between the muscles, or on top of it. And those are fibroids. A majority of the time, fibroids are not cancerous, but I will say that about 1% to 2% of them can be. And so while if you do a Google search, I'm sure it will say a non-cancerous growth. And I just like to say that it's a non-cancerous a majority of the time. And so we don't want to be complacent or just say that we have fibroids and we're okay with it, because not all fibroids are created equal. So keep up with your provider and your doctors to make sure that the fibroids that you have are not cancerous. All right. Now, fibroids can be in the inside area of your uterus. Those are called submucosal. They can be in the muscular area of your uterus. Those are called intramural. Or they could be subserosal, or on top of your uterus. There's also a fourth kind as well. That's a pedunculated fibroid. And that just means that it hangs off of your uterus. When your doctors tell you that you have fibroids, the first question that I think you should ask is, where are they? What kind of fibroids do you have? Because depending on where they are will determine whether or not you'll have symptoms. And some of those symptoms can be that you have irregular periods. And irregular periods can mean that you have a period that lasts 5 to 7 days, and then 2 or 3 weeks later, you're having bleeding again. And so typically you should have a period between 21 and 35 days. And so if you're having another bleed a week after your period ends, that's abnormal. It could also mean that your periods may last longer than they normally would. So for instance, if your periods normally last 4 to 5 days, with fibroids, your periods may last 2 weeks. Or sometimes you may have consistent bleeding. I can't tell you how many patients I've had who've had bleeding every day. And they'll say, hey, Dr. P, I've been bleeding for 4 months. And I'm like, oh my gosh, how? Is that possible? It is possible, but it's not normal. And so fibroids may cause irregular bleeding, and that can look differently from person to person. Fibroids may also cause you to have pains in your pelvis. You could be sitting down like I am right now and just doing your work at work on the computer. You can have pains when you're moving or exercising. You can have pains with sexual activity. Any kind of movement can cause pains when you have fibroids. You can also have a lot of pressure and fullness in your lower abdomen. Fullness meaning that it feels like something is living inside of your pelvis. And fibroids essentially can really take up the space of your pelvis. They can make you feel full because they can literally push your organs and distort them and put them in places where they don't typically belong. With fibroids, you may have symptoms like urinary frequency, where you feel as though you need to urinate all the time. As soon as you drink some water, you have to prepare to get to the bathroom because you're going to need one very soon. Sometimes you can have the feeling of being full in your bladder, even though you just went to the bathroom and you just peed, and your bladder is typically or should be empty. Sometimes also you may have symptoms of feeling or seeing that your belly seems to be growing. It seems like as much as you work on losing weight or working out, your abdomen is getting bigger and bigger and bigger from year to year, regardless of what it is that you do and how your lifestyle is. These are some of the symptoms, but there are so much more. The problem here is that fibroids may grow and grow and grow. On average, fibroids grow about 1 to 2 centimeters per year. And so in about a 5-year time span, your fibroid that initially may have been 2 centimeters can be 7 or 8 centimeters, or even bigger than that. The bigger your fibroids become, and depending on where they're located, may lead to you having more pain compared to the others. While talking with my patients or counseling my patients, sometimes it's shocking to know that you have fibroids and you have no symptoms. I've had patients all the time, so many times. They'll say, Dr. P, I have no issues. I feel absolutely nothing. My periods are perfect. I have no pain. And then you show them an image or a picture of their pelvis and their uterus, and you're like, you have like 8 fibroids. And they're just like, how is that possible? And so yes, a majority of people do not know they have fibroids because they don't have any symptoms. But if you do, pain is a big one. Now, if you are pregnant, this is no different in the pregnant state. Fibroids may grow and are likely to grow during pregnancy because they love hormones. And so as your pregnancy is growing along, you're producing more and more hormones to support that pregnancy. The more hormones you have, fibroids are just like, ooh, give it to me, give it to me. And so they grow and grow and grow as well. In addition to all the pregnancy-related pains that you may have, fibroids may add to that and cause pains as well. And a part of that reason is as the fibroids are growing and the uterus is growing, fibroids are constantly being next to something else. So for instance, if we think about our pelvis here, normally in the early parts of pregnancy, I'll actually show you a uterus here. This is the size of your uterus normally, right? If you do have a fibroid next to your uterus in early pregnancy, this is likely what it could look like, right? Very small. But as your uterus grows and gets bigger and bigger and bigger, it moves outside of your pelvis. And as it does so, the fibroid is moving along with it. So the fibroid may now, instead of it being low in the pelvis, might be now on your side. Mine was on my side. Like literally, I would touch my sides during pregnancy and you can feel the fibroid bulging there. Or if the fibroid is on top of your uterus, as it grows, it can push against your diaphragm and your lungs and your heart as well. And so depending on where your fibroids are, can really dictate how much pain and the types of pain that you may feel. And so what do we do about these? Well, the first thing is to know where your fibroids are. The second is to track them. The way we do that is with an ultrasound, and your provider should be able to guide you with that. During pregnancy, we have them scheduled throughout in your first, second, and third trimesters. There's another type of pain that I'd like to mention to you that we don't talk about enough, but is very likely. Sometimes during pregnancy, your fibroid can change form. It's called degeneration or degenerating fibroids. And so it means that while your fibroids are normally like hard and white, your fibroids can change in their consistency, where they're not as hard anymore and they become a little bit softer. They can change their color, so they can become, instead of just being white in their normal state, they can become red or pink or brown. And every now and then, a fibroid can start to shrink in pregnancy if they're degenerating. The problem with degenerating fibroids is that they are painful. Literally, as they transform from state to state, they cause an immense amount of pain. This is not pain that comes and goes. This is not pain that is just random here or there. This is constant pain, which often requires a lot of intervention. And so depending on your scenario, again, this is why it's important to talk to your provider and get your ultrasounds to monitor the state of your fibroids. If these are a problem for you, you can always try Tylenol. You can always use warm compresses to help how you're feeling. You can always use like a pregnancy belt to help to support your uterus and your pelvis. But oftentimes, delivery is what will bring you relief. I hope this makes sense today. Thank you so much for listening in. If you've learned something, drop a comment below. But listen, better than that, I have a free gift for you. Just for listening to us today, I'd like to offer you a free copy of my ebook, Hormones Don't Lie. This is such a great resource to have to help you as you navigate through your hormonal journey in life, and I'm here to help you with that. Click the link below in the description to get your free copy today. Thank you for listening, and I hope to see you next time. Take care.